My name's Whisenand.
And I'm Kyle Audis.
And we are the team lead staff for the Oscar Offsite Screening and Care Room Triage System for Yavapai Regional Medical Center. We wanted to give the community an update about how we are screening for COVID-19 here in Yavapai County and the Prescott area, and what we're doing here at Yavapai Regional Medical Center to keep our staff and patients safe. The process starts at the main entrance of the hospital, both Yavapai Regional West and East. There's a screening process where all individuals entering the property will be asked if they have any symptoms of COVID-19, including cough, fever, shortness of breath. They'll have their temperature checked, and as long as they don't have any positive symptoms, they'll be given a green wristband and they'll be allowed to enter the hospital.
So what we've done to mitigate some of the risk is we've made two entrances. We have the main entrance, which is going to be to the hospital, which is going to be for our employees. The emergency entrance will be for patients. They'll be screened, and then they'll either be given a green wristband so they can be permitted entry into the hospital to go about their day and receive care, or they will be directed to the tent where we'll begin care there and begin the triage process for the COVID-19.
So once the patients have been screened, if they have determined that there are any symptoms that need to be screened for COVID-19, they'll come to the tents on either campus. Both tents are set up exactly the same, and the care process is exactly the same. They'll enter through the main door.
This is where they begin the screening process. They'll meet our fine staff here.
The tents are both staffed with an emergency department nurse and tech, or another qualified nurse from another department. They'll come in, they'll be given a mask, a surgical mask for protection of the staff, as well as they'll do hand hygiene, make sure that their hands are washed and clean when they come in. The staff will register them just like they would if they were in the emergency department. Our IT department here at the hospital was wonderful and ran data cable across from the hospital, so we have full IT capabilities just like we would in-house. This would be an extension of our triage area. So we've got full computer capabilities, we have landline phones.
We have 5 areas where we can begin triage, so we can begin to triage 5 people all at once, and make this process as smooth and as quick as possible so we can get these people the care that they need.
Once the patients have been checked in, they'll go through a quick screening process, so one page with the nurse. If they have, once they've gone through the screening process, we have telemedicine that's available. All of our patients will see a physician via telemedicine with the on-duty emergency department physician. The physician will then determine if the patients need any further screening. If they need anything further than a COVID-19 screening, we will take them into the emergency department. They'll be treated in the main emergency department. The goal of this tent is to help keep patients with potential COVID symptoms that could self-isolate at home out of the main ER, thereby protecting our vulnerable populations here in Prescott.
By having this tent here, we're able to separate and mitigate the spread of the COVID-19 by keeping the patients here until we're ready to either move them into a more,
critical
care. So as you walk through this tent here, we have UV lights to help kill some of the virus and bacteria. This is where we will don and doff full PPE if we need to administer any tests.
Personal protective equipment. So the full personal protective equipment that's required for the staff to take care of anybody who is a potential person under investigation for COVID-19. We also have a third area back here that's a holding area for patients that are waiting to go to the emergency department or they're waiting to be admitted to the hospital. We have 3 gurneys back here to be able to provide care for patients, just in the instance of patients needing to go into the ER and the ER getting ready for them to arrive. That way they can continue to protect the rest of the population of the emergency department. In this area, we also do any sort of procedures where there might be an aerosolization of any potential COVID-19. So if the patients come in and need to have a swab done, an influenza swab, a strep swab, or a COVID-19 swab, it would be done in this area with full personal protective equipment by the staff.
Now this tent is fully equipped with 2 HVAC systems, one for the triage area, one for the hold area. These HVAC systems have a HEPA 13 or MERV 13 filter in them, which will kill and trap virus and not put it out into the atmosphere or recirculate it back into the tent to further keep patients and staff safe and keep it from spreading.
And the tents are also, as Kyle said, they have independent HVAC systems. So the air from the tent where we do procedures at is separate from the air from the tent where patients are triaged at. And the idea with that, again, is that we're separating patients that might be aerosolizing if they're coughing when they have to have a swab done. It's not being spread into the tent where other patients are sitting.